As COVID-19 continues affecting the world day by day, we can only stay home and get updates on the ongoing pandemic through all sorts of media platforms. Yet, not all the information on the internet are true, causing unnecessary doubts and stress. It is very important to acquire accurate information about the disease during the pandemic. Here's the top up-to-date facts about COVID-19. Fact number 1. COVID-19 is not a death sentence for anyone who was contracted by the virus. Most mild to moderate COVID-19 cases can recover in 1 to 2 weeks without any special treatment. The World Health Organization states that people who are over 60 years old or have underlying medical conditions may be at higher risk for serious complications. This also eliminates concerns about whether people of all the ages can get away without worrying about getting infected by the novel coronavirus. The fact is, people of all ages can be affected by the disease, and we should take it seriously. For most people, the immediate risk of becoming seriously ill from the COVID-19 virus is thought to be quite low. Fact number 2. People who have completed quarantine or self-isolation do not pose a risk of infection to the community. On the other hand, despite the patient's healthy physical state, those who are still under treatment can still be a contagious source. These patients must work with the doctors after the treatment in multiple examinations to ensure they are no longer a potential risk of infection. Fact number 3. Most common symptoms include fevers, dry coughs, and shortness of breath. You can seek medical attention if you are developing any of those symptoms and/or have been in close contact with a person known to have COVID-19. Close contact includes if the person lives with you or has recently traveled from a widespread area infected with the disease. Please don't go directly to a medical service without giving prior notice to public healthcare workers. Fact number 4. Some reports have indicated that people with no symptoms can still transmit the virus. COVID-19 is mainly spread through respiratory droplets expelled by someone who has symptoms such as coughing, fever, or tiredness. Many people with COVID-19 experience only mild symptoms. This is particularly true in the early stages of the disease. It is possible to catch COVID-19 from someone who has just a mild cough and does not feel ill. Fact number 5. Coronavirus on surfaces can be easily cleaned with common household disinfectants. Studies have shown that the COVID-19 virus can survive up to 72 hours on plastic and stainless steel, less than 4 hours on copper, and less than 24 hours on cardboard. Always clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, mouth, or nose. Fact number 6. There's no evidence that pets can transmit the disease to humans or play any role in spreading COVID-19. Several dogs, cats, and ferrets in contact with infected humans have tested positive for COVID-19. In experiments, both cats and ferrets were able to transmit the infection to all the animals of the same species, but cannot transmit the disease to humans. COVID-19 is mainly spread through droplets produced when an infected person coughs, sneezes, or speaks. Basic hygiene measures should always be implemented when caring for animals. This includes washing hands after handling animals, their food, or their supplies, as well as avoiding kissing, licking, or sharing food. Fact number 7. Due to the shortage of surgical masks for the first-line healthcare workers, the U.S.'s Centers for Disease Control and Prevention advises the public to use cloth face covering, yet with caution. Masks that are made of cloth poses a wide range of limitations. They are not specialized for medical purposes, and the edges are not designed to form a seal around the nose and mouth. Use them with these cautions in mind. Try not to touch your eyes and around your face when removing the mask, and wash your hands after you have removed it. Fact number 8. Antibiotics are not effective in preventing or treating COVID-19. Antibiotics only work on bacterial infections. So, antibiotics do not work against COVID-19, which is caused by a virus. Antibiotics should not be used as a mean of prevention or treatment of COVID-19. In hospitals, physicians will sometimes use antibiotics to prevent or treat secondary bacterial infections, which can be a complication of COVID-19 in severely ill patients.